Hi, Dr. Matthew Weiner from the Pound to Cure Weight Loss Center. Going to talk to you today a little bit more about the surgical treatment for heartburn after a sleeve gastrectomy. And in my practice, I offer patients two options. The first option is dependent on what we find preoperatively. So we always do an endoscopy in patients with significant heartburn. That's one of the ways we diagnose Barrett's esophagus, which I mentioned in the last video. But when we do the endoscopy, we're looking for a hiatal hernia, where the stomach pooches up into the chest. Normally, the esophagus is in the chest, the stomach is in the abdomen, but with a hiatal hernia, that stomach can slide up, and that valve, that gastroesophageal junction valve that's supposed to prevent acid from going up into the esophagus, doesn't work very well in the chest because the negative pressure that we exert with every inhalation just sucks the acid up, and that valve opens up and it allows it to go right up into the esophagus. So in patients who we find a significant sized hiatal hernia, now almost every sleeve patient's gonna have a small hiatal hernia. I don't get too concerned about small hiatal hernias. I don't think there's a ton of benefit to repairing those, but when the hiatal hernia gets bigger, we may, and that's the important word here, we may have some relief or complete relief by repairing the hiatal hernia alone. And that way you get to keep your sleeve, but you don't have the same success rate that we have with the other option. So we'll see about 50% of patients have substantial resolution of their symptoms from a hiatal hernia alone. The definitive or kind of gold standard treatment of acid reflux after a sleeve gastrectomy is to convert that sleeve to a gastric bypass. Now with this procedure, there's nearly a 100% success rate. And patients tell me it's like we turned off their heartburn with a switch. The night before surgery, they're propped up on pillows, they're refluxing, they're having severe acid in their chest and burning and even food coming out their nose. The morning after surgery, it's gone. And if you're looking for the definitive complete treatment of these symptoms, converting to a gastric bypass will offer you about as close to 100% success rate as anybody can offer in medicine. It's an incredibly effective treatment. The issue is that now you have a gastric bypass and you originally chose a sleeve. So why did you choose a sleeve? Clearly, if you're looking for a revision, you aren't as happy as you thought you'd be with a sleeve. You have to understand the consequences of life with a gastric bypass. Now, it can be a very, very comfortable life, but you got to eat right. You can't smoke. You really can't drink alcohol. You have to avoid NSAIDs. And you have to talk to your bariatric surgeon and make sure you understand not just about getting rid of the heartburn symptoms, but what life is like after surgery so that you can maintain the ideal lifestyle to maximize your weight loss that you can achieve from this, and also to minimize any side effects like dumping syndrome or hypoglycemia. Now, another note about weight loss. A lot of people think, well, I'm having another revision surgery, so I'm going to lose a ton of weight with this surgery. The truth is, weight loss varies a lot when we revise from a sleeve to a gastric bypass. If you have regained a substantial amount of weight from your sleeve, we'll often see you lose that weight that you regained. You may even get a little bit lower than you did before your sleeve. If you've had good weight loss with your sleeve or haven't regained weight after your sleeve, we don't see as much weight loss after revision to a gastric bypass. We may see 10, 20 pounds or so, but we don't see 40, 50 pounds that some patients may want. So when I talk to patients about revision to a gastric bypass from a sleeve, if you're doing it for heartburn, you're going to have a great result and you're going to be really happy. If you're doing it for weight loss, my honest opinion is there's probably better options, and I usually will start patients on a GLP-1 medication like Wegovy, Ozempic, or Mounjaro if we can. We see great results in treating weight regain or getting patients to lose additional weight after a sleeve. And that's my preferred approach for weight loss after a sleeve if that's what we're really looking for. So I hope this was helpful and cleared up and clarified some of the confusion that exists around heartburn and a sleeve gastrectomy and revision to a gastric bypass.